Hello, everyone. Today we're going to be talking about my unit, Unit 6, Healthcare Financing, for my New York Times presentation. My article that I've selected goes a little bit into more detail about some of the crossover between Medicare and Medicaid and the balancing act that the government has to do right now between the two and which ones to expand and things like that. So move on to this summary slide of the article. So you can see here the title of the article saying that essentially right now Congress is having a difficult time with some clashing desires to expand Medicare, but also expand Medicaid. Expanding Medicare would benefit the older population, but expanding Medicaid would benefit more of the indigent population. So members of the community who don't make a lot of money or are facing hard times. So essentially right now, there is a $3.5 trillion social safety plan that is facing major cuts, and Democrats are disagreeing with this current plan. Many Democrats are for this plan, but there are a few that are threatening to, make some major cuts to this plan to make it work and pass through the Congress. One of the biggest things is that many states refuse to expand Medicaid at all. With the passing of the Affordable Care Act and in a desire to get more and more people covered by insurance, and really essentially the goal was to have everyone covered by insurance, the expansion of Medicaid and Medicare really is important, and so the government kind of takes that into account all the time and how they can do better and how they can use taxpayers' money to improve those services that the government is providing. I think Senator Warnock from Georgia said it really, really great. He was saying, essentially, in a quote from him, that, there are people that are dying because of the lack of access to healthcare and the lack of access to health insurance. So the current guidelines for Medicaid allow a certain number of people to, get into those programs based on financial status. And right now, a use of expansion of those guidelines would help more people to be covered by some form of insurance and help them feel comfortable getting health care. There are many, many, many people that don't feel comfortable going to do that, or know that they won't be able to afford the health care, the services that they need, and so they just refuse them. And they deny their symptoms, they deny things like that to save themselves money because they don't have any form of coverage. So they are experiencing really, really hard times. And especially, I think, right now in a time where there is a global pandemic where the health of the nation is, one has been of utmost importance for the last almost 2 years at this point. Health care and health insurance has become a really big topic of conversation, and the expansion of Medicaid and Medicare to cover as many people as possible, I think we're realizing is more and more important, because we want more and more people to be able to have access to healthcare services and have access to treatment and testing and the ability to just have knowledge about their own health. Our text mentions that some data from the Kaiser Family Foundation, that 36% of the United States is covered by Medicare, Medicaid, or some other public form of insurance, with the large majority of that coming from Medicare and Medicaid. So it's not a small portion of the population that is benefiting from these. So it's really important that we take these services really, really seriously and take them to account and understand, who's using them and what they're using them for. Medicare, as we know, has 4 parts. So it has that Part A, everyone's entitled to as they have paid into it their entire lives through taxes, that hospital coverage. And then there is Part B, C, and D, which are all optional supplements. B being that supplementary, so providing extra services. C being that Medicare Advantage, getting linked with a managed care organization, and possibly providing sometimes even that Part D, which is that prescription drug coverage, which cuts down on the costs of those prescription drugs, which, as we know, there's a growing older population as we are living longer with the healthcare services that we have. So more and more people are going into Medicare or are being able to take advantage of that. And also, as we get older, we have an increased risk of disease. And so more times than not, we're on more prescription drugs. So having that prescription drug coverage is a really important aspect of that service. Now, Medicare does pay a lot of out-of-pocket costs, so the coverage that they get through Medicare is great. It does help save on costs, but it still forces them to pay a lot of out-of-pocket costs, which they usually supplement with some or the other form of private insurance. Some Medicare beneficiaries also qualify for Medicaid, so there is that coverage as well. But all the money in total comes from taxes, and they do have to pay down. They have to pay. They do have out-of-pocket costs, like I was saying, and they do have to cover certain things. But they definitely have help with that Medicare coverage. Now, the biggest argument in Congress right now is that the expansion of Medicare. So I think the biggest thing they want to expand is the dental, vision, and hearing care for Medicare beneficiaries. They're saying that expansion is something that can wait and something that can be focused on at a later time, because there is so many people that aren't covered right now because of financial issues. So Medicaid, the focus on expansion of Medicaid and getting states to expand Medicaid is really important. The major components of this bill that they're trying to pass, which you can see here, are closing that coverage gap. So essentially, the members of the population that don't qualify for Medicaid, but also do not make enough money to pay for private insurance, are not being covered at all. So to get them some coverage, so expanding that section of Medicaid, providing dental, vision, and hearing care for Medicare, and then, like I said, assisting those middle income individuals with getting coverage. That is the goal, but obviously there are people who are not agreeing to that bill, where it would be a huge cost to expand that, and I think people want to focus either on one area or another. So focus on expanding Medicare and expanding Medicaid. So that's where we see that clash of the two services that the government provides. Congress has certain people agreeing to expand one and certain people agreeing to expand other. And so it's finding that middle ground that's really, really important, so that we're getting people, the service that they can. Now, the Affordable Care Act, and even in recent years with the pandemic and everything, there has been huge incentives for states to expand their Medicaid. So essentially, under the Affordable Care Act, there was an incentive initially that 100% of new expansions would be covered by the federal government, and now, as of 2020, it's 90%. So states have the ability to expand that and not incur huge costs, because the federal government is willing to put a lot of that money in. So There are a lot of states that are just refusing to. There also, in the pandemic, there was obviously huge um, pandemic rescue bills uh, that were put into place. So a $1.9 trillion pandemic rescue bill that had provisions for states to expand that Medicaid coverage, and not one state that hadn't expanded Medicaid did. So even though there was huge incentives, not one did. And the states that had already expanded it years and years ago with the Affordable Care Act kind of going into place, and uh, the federal government providing more coverage, were feeling a little bit like that it was unfair. Essentially, they were the ones who took the job at the beginning, and they expanded Medicaid right away to assist all those indigent individuals. But all those states that haven't still haven't, and are being given the opportunity to expand with lower costs than the other states did. So there's definitely some fight over that in terms of expanding Medicaid for the government. Now, to go a little bit more into Medicaid, it does depend on one's financial status. So, like I was saying, that's why there is that coverage gap, and why there is those certain people who don't qualify, but also don't make enough to qualify for private insurance as well. They just don't have the ability to get covered by either, so they end up with no coverage at all. So Medicaid does also allow essentially what they call like a dual enroll, where you can be certain elderly individuals, and certainly certain young and disabled individuals can qualify for certain parts of Medicaid and certain parts of Medicare, and sometimes even the full benefits of both. So that helps, but also puts an increased cost on the government. Now, in 2016, like I was saying, as of 2016, there were 19 states who hadn't expanded Medicaid at all. And some research was done, and in our text it mentions this, that currently to expand that Medicare, if every state were to do so, we would need more primary care physicians than we already have. So there is also the need to expand, education, and expand a push into primary care. There are a few things about Medicaid that have caused issues, such as there are much lower reimbursement rates for services with Medicaid. So what happens is a lot of physicians, a lot of offices actually refuse Medicaid coverage. So that limits the amount of physicians and the amount of service providers, essentially, that beneficiaries of Medicaid can even go into. Now, there is also the issue of Medicaid. The beneficiaries who take advantage of the services that are available, because they have fluctuating income, they go in and out of being eligible for that Medicaid. So to really understand the full percent of the population that is taking advantage of Medicaid is really, really difficult to do, just because there are so many people fluctuating in and out of that coverage of all time. But to get back to the bill that's trying to be passed, essentially what would allow for this in this bill, it would actually allow for Medicare to negotiate with drug manufacturers to change their prices. So that would allow a cost cut in that drug section, and by making that cut would save a lot of money and allow a lot more money to be put into these expansions of healthcare coverage. So essentially what's being argued over is that Medicaid expansion for the people who need coverage, but also the Medicare expansion for those older individuals who need more coverage than they already have. So I think you can see, obviously, where that clash is coming into, and the ramifications that it has for our country and the cost. But I think that it's important that we come to an agreement and definitely expand coverage worldwide and get more people covered by insurance so they can access those services.